2 to level 4. The dispensary, the health center, the sub-county, and their equivalents, both in the private and faith-based. You access, you are treated, you get medicine, you get everything, and you walk free, courtesy of your government. Additional services that chief, the social health insurance fund for all paid-up members available at level 4 to level 6, and all contracted private and faith-based facilities. Then we have the emergency service, as I said earlier, for all Kenyans.
Health Cabinet Secretary Aden Duale appeared before the National Assembly to defend and clarify the government strategy under the Social Health Authority SHA programs, emphasizing its role in delivering equitable, affordable, and quality health care to all Kenyans. He addresses various concerns from lawmakers, including questions on health care financing, local pharmaceutical production, and the challenges it inherited from the previous NHIF model. Duale highlighted the improvement brought by the SHA program compared to the defunct NHIF, noting that services such as ICU care, surgeries, and cancer treatment have seen improved or increased support under the SHA. He stated that the new system aimed to ensure drugs are available, facilities are well equipped, and healthcare personnel in places across all nations. The use of digital system and improved involvement of pharmacy and poison board would help in tracing and tracking medication, thereby eliminating counterfeit drugs from the market. He also acknowledged the high maternal mortality rate in Kenya and attributed it to the past inefficiencies in the health system. He expressed confidence that SHA, with its new patient-centered approach and payment structure based on actual treatment, would lead to improved outcomes and accountability. Responding to questions about whether SHA or the program would support local pharmaceutical manufacturing, Duale stated that the SHA's primary focus was healthcare delivery. There was an agreement that Kenya needed to invest in local drugs production. He urged the parliament to support the pharmaceutical sector by adjusting import duties to favor the local manufacturers and incentive production. He stressed the importance of building capacity for the cancer treatment and ensuring medicals were not diverted to private sector.
House, and that is one of the things that has never been in our country, and that is why we are saying if you register and you go to level 2 to level 4, the dispensary, the health center, the sub-county, and their equivalents, both in the private and faith-based, you access, you are treated, you get medicine, you get everything, and you walk free, courtesy of your government. Additional services that chief, the social health insurance fund for all paid-up members available at level 4 to level 6, and all contracted private and faith-based facilities. Then we have the emergency service, as I said earlier, for all Kenyans. You don't need registration or payment required. Any emergency. For example, a boda is knocked down, God forbid, by a vehicle. He is rushed to a hospital. He doesn't need to register. He doesn't need to pay. Nobody can deny him. No facility can deny him treatment. And he walks away home. This is something that has never been there, but it is in law. Article 43, sub-article 2 of the Constitution, where at the Bill of Rights, require government to do that. The last one, service we offer is chronic and critical illness services for all SHA paid members at level 5 and level 6. The details of these services that the member have asked, Mr. Speaker, are set out in legal notice number 47. The NHIF was not required to publish, but this House allowed us. Those services you can access, and a legal notice number 47 was created. The gazetted benefits are a huge improvement from the previous benefits offered by the defunct NHIF. They are aligned to the projected collections. These benefits we shall continuously improve in tandem with available resources. For instance, Mr. Speaker, this month, SHA and the ministry, we have enhanced the ICU package from 4,000 to 28,000 per day. And additionally, we have increased 150,000 extra for all cancer patients. And that is because of that chronic and critical illness services. Mr. Speaker, the next one was about the referral system. There is 3 levels of healthcare services or access in the referral system as shown below in the document that I've given to the colleagues who asked this question. All registered SHA members, Mr. Speaker, can